conference on the coronavirus response in Davidson County. Let's listen in.
Of Thistle Farms. Dr. Michael Caldwell, Metro's Public Health Director, and Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department are here with us to help answer your questions. We will now begin with Mayor John Cooper.
Good morning, Nashville. I'm grateful to everyone continuing to closely follow the Safer at Home order to help flatten the curve of coronavirus disease here in Nashville. If the nature of your business outside your home is not absolutely essential, please remain inside. Practice social distancing to protect yourself and others, and remind others to do the same. I'm happy to report that 7 o'clock last night, the Tennessee Air National Guard secured delivery of the COVID-19 test kits required to get our community assessment centers fully operational within approximately 48 hours. I'm grateful to Governor Bill Lee and the state's COVID-19 Unified Command for collaborating with the Coronavirus Task Force to help secure these needed medical supplies. We will continue to keep everyone updated on the progress of the assessment centers in real time, and Dr. Jahanger will provide more details on the assessment centers in his update. Since the outbreak of the coronavirus here in Davidson County, individuals and organizations throughout Nashville have quietly performed great acts of generosity to assist our city. I'd like to take a moment to recognize some of their efforts and thank them for their support on behalf of all Nashvillians. Hotel spas and restaurants that have temporarily closed, including the JW Marriott 404 Kitchen, Merchants, the Renaissance Hotel, Gaylord Opryland, and Made First, have donated over 59,000 pairs of protective gloves and over 2,000 masks to first responders and healthcare providers. Acme Feed and Seed, the Southern Nashville Merchants, and Pinewood Social have been providing meals to help Metro employees who are working at the Emergency Operations Center, many of whom have been there 7 days a week since the March 3rd tornado struck our city. Ferguson Appliances has donated 12 refrigerators to keep medical teams running throughout Davidson County. Dollar General Corporation donated pillows, blankets, and other linens for Metro's emergency COVID-19 homeless shelters. Our very own Tennessee Titans contributed $50,000 to the COVID-19 Response Fund to help Nashvillians in need of assistance during this time. Yesterday afternoon, a local veterinarian donated 500 unopened sterile swabs, a critical component of the COVID-19 test kit. And Nashvillians with sewing machines all around the city, including some of our youngest residents, are sewing face masks for non-medical staff to use to address our nationwide shortage. Now, to join this volunteer group, search for MedThreads Volunteers Nashville on Facebook. MedThreads Volunteers Nashville. Now, these are just a handful of the good deeds happening in our city. There are thousands of acts of kindness happening every day, from individual contributions to the COVID-19 Response Fund to neighbors calling each other just to check in. We are a resilient community, and we will get through the challenge of coronavirus together. Now, to make your own financial contribution to the COVID-19 Response Fund or donate personal protective equipment, visit covid19.nashville.gov. To donate other food or other types of equipment to our city's coordinated COVID-19 response, send us an email at safeathome@nashville.gov. safeathome@nashville.gov. Like many of you, I took the opportunity to enjoy yesterday's warm weather and get a breath of fresh air while maintaining proper social distancing. And we should enjoy the outdoors as much as we can. But I do want to remind everyone to keep an eye on the weather. Current forecasts call for a chance of storms late this evening with potentially damaging winds. So check local weather forecasts, plan ahead, and have multiple ways to receive weather warnings. You can visit means.nashville.gov to sign up for weather alerts from the National Weather Service. And then tomorrow, of course, is Sunday, a day when many Nashvillians would normally gather at houses of worship for communal services to practice their faith. But these are not normal times, and our city is facing a public health emergency. I urge all congregations to follow the safer at home order and find ways to worship from the safety of your own homes. I'm grateful to Bishop Joseph Walker of Mount Zion Baptist Church and Reverend Becca Stevens of St. Augustine's Episcopal Chapel for joining us this morning to talk about the importance of faith, especially in times of challenge, and how we can practice it while safeguarding our own health and the safety of others. I encourage all of you to continue sharing your own stories of kindness, compassion, and courage as our city confronts two historic challenges: the March 3rd tornado and the coronavirus. By using the hashtag #NashvilleStrongStory on social media and to visit covid19.nashville.gov to learn about more ways to help your fellow Nashvillians at this time. Now, in an effort to assist the Nashville Rescue Mission to achieve compliance with the CDC guidelines for social distancing, Metro has opened an emergency facility at the Nashville Fairgrounds to provide accommodations to help our unhoused and unsheltered neighbors adhere to Nashville's Safer at Home public health order. Any Nashville residents who are interested in volunteering to assist at the emergency shelters can help provide basic shelter care, such as welcoming and signing in guests, the delivery of food and beverages, assisting with social distancing compliance, and providing a comfortable space for our most vulnerable neighbors. As you determine your ability to volunteer for this much-needed assistance, here are a few points to consider. No one who is COVID-19 positive will be sheltered at the Fairgrounds facility, staffed by volunteers. Fairgrounds guests will have been pre-screened at the rescue mission by EMTs for any sign of illness. Public safety personnel will be on site at all times to protect shelter guests, staff, and volunteers. And volunteers will be provided training and appropriate personal protective equipment. Now, residents who are interested in volunteering and receive online training by the American Red Cross should contact the Nashville Rescue Mission by calling 615-312-1544. And now I would like to turn this over to Dr. Jahanger, the chair of our Metro Coronavirus Task Force. Thank you very much.
Thank you, Mayor Cooper, and good morning, Nashville. Here's the latest updates for Nashville. We have had a total of 376 confirmed cases with a total of 2 fatalities. This is an increase of 64 cases in the past 24 hours. The patients range in age from 2 months old to 84 years old. Of the confirmed cases, 14 are currently hospitalized. 297 cases are self-isolating at home and have mild and manageable symptoms. 63 people who were confirmed cases have recovered and are now cleared. In addition, there have been more than 4,100 Nashville residents who've tested for COVID-19. On Monday, we will launch our community assessment system for those concerned about whether they have the COVID-19 virus. The first step in this assessment system is to call our assessment hotline at 615-862-7777. The hotline is staffed by healthcare workers who can answer your questions and help you determine if you need to be further assessed. If needed, you will be referred to your local healthcare provider or to one of our community assessment centers. These drive-through centers will further assess your symptoms and, if indicated by medical protocol, give you a COVID-19 test. On Monday, one will open in the Nissan Stadium parking lot. And in conjunction with the COVID-19 task force, Meharry Medical College will also open a second center. On Wednesday, a third center will open in Antioch at the old Kmart location on Murfreesboro Road. These centers will open Monday, Wednesday, and Friday from 9 a.m. to 3 p.m. And I want to emphasize, this community assessment system is in addition to the world-class healthcare system of hospitals and medical schools we already have in Nashville. The system expands our capabilities in the city to assess even more residents and conduct even more tests. We must work together to prioritize the people who need to get assessed and receive the test. That is why we are asking you to call the assessment hotline before coming to the assessment center. After speaking to the healthcare professionals on the hotline, they may tell you that you do not need to make the trip to the center to get further assessed. These centers are also for Nashville residents only. And very importantly, there will be no charge for the assessment or, if needed, the COVID-19 test. I would like to, again, take a minute and express my appreciation to all who have worked together to launch this community assessment system. I thank Mayor Cooper for his leadership and support. I appreciate Governor Lee and Commissioner Piercy and the leaders of the State Unified Command for their efforts to get us the test kits we so urgently needed. I also want to thank our great healthcare partners, HCA TriStar, Meharry Medical College, Nashville General Hospital, St. Thomas Ascension, and Vanderbilt University Medical Center. Also, Director Chief Swan and the Office of Emergency Management, Dr. Caldwell and the Metro Public Health Department, and all Metro employees who have worked tirelessly. And I also want to thank you, the people of Nashville, for your support and your patience, but we still need your help. If you have supplies that you are not using, please donate them. We will continue to need them at our assessment centers and for our first responders. Go to covid19.nashville.gov to see what we need. If you'd like to make a smaller donation, please bring them to the Community Resource Center on Omohundra Place. It is open Monday through Saturday from 10 a.m. to 4 p.m. Again, I thank you all so much for your response. Finally, we continue to be under the Safer at Home order. I need you to stay focused, and I need you to stay at home unless it's absolutely necessary. Yes, you can go outside and enjoy the fine weather as the mayor suggested, but please remember, please stay 6 feet from each other. Right now, this is the best way to flatten the curve. You will help save lives. You know, as always, we truly are all in this together, and together I know we will get through this. Thank you so much for all everyone is doing. I now have the honor to turn this over to Bishop Joseph Walker, Senior Pastor at Mount Sinai Baptist Church.
Thank you so much. These are challenging times for our city. And I want to say, first of all, thanks to our mayor for the extraordinary job he is doing in helping us navigate this unprecedented season. To all who are working behind the scenes and those of us in the faith community, we certainly appreciate all of you. This is an ecumenical response, but I am encouraging all of us to abide by the CDC's guidelines in social distancing and to encourage all folks in our great city and surrounding areas to make certain that you maintain social distancing. It is critical and important in this time that we absolutely do what is necessary to make certain that we are being careful and that we are assisting those who are on the front lines every single day to make our community a safer place. I also recognize that tomorrow is Sunday. Today is Saturday. Many of our faith communities are gathering, are hoping to gather, but I want to encourage you to gather in places, homes, in small groups. I believe it is important now for us to lean on the innovation and creativity that technology affords us and to be able to worship God in our homes and to make certain that we do what they did in the early church, from home to home, and to spread that faith and to let each of us know, regardless of our faith, that we can get through this. Nashville is a resilient city, and it is our faith, not just our faith in the God who is above us, but the faith in the God who is in us as we help each other through this tumultuous time. I believe, without a doubt, that our faith will pull us through. At this time, I would like to introduce Reverend Becca Stevens, founder and president of Thistle Farms and chaplain of St. Augustine Episcopal Church.
On behalf of my husband, Marcus Hummon, and I, we are so happy to be standing with the mayor and the whole community, offering some love and light, because this is a new experience in our community, but it's not new in history. There has been, in Ecclesiastes' words, times to weep and times to laugh. There is a time to embrace and and a time to refrain from embracing. This is a time to refrain. Knowing love transcends 6 feet, and generosity can easily span the distance we have to keep in our social ways. This is a community that shows up after storms, and we are a community that stays home in pandemics to allow the work of our frontline heroes to carry the day. This is a time for all of us to be community, apart, together. This is a time that we get to be humble, and we get to become courageous, even by something we cannot see and something that we do not know. This is a season to feel safe in the hallowed green pastures of hope, not stuck in the shadowed valley of fear. We are a community that can worship alone at our own altars, that can worship under the tulip poplars, and that can sing silent hymns. We have learned from every faith that have experienced everything, every purpose and circumstance under heaven, that the question in all our suffering is how long? And the answer from our God, from Abraham, from Moses and Job, is I am with you. And while that may not seem to be the answer that we seek right now, that answer is so high and so deep and so wide we cannot attain to it. I am with you, says our God, when you wrestle with your deep fears and worries in the middle of the night. I am with you when you share what you have with your neighbors in the bright light of day under the red buds blooming. I am with you as you weep and as you laugh. I am with you as you mourn and when it is time once again to dance. I am with you until you reach the other side of time, where we will embrace love forever.
Thank you to Bishop Joseph Walker, the Reverend Becca Stevens, and Marcus Hummin for joining us this morning. We will now start the Q&A portion of today's briefing. I will announce your name out loud from the podium, at which point you may proceed by asking your question over the air. Kara Hartnett.
Hi, I actually have 2 questions for you today. My first one is, are the assessment centers located where you've identified clusters in the community? And I guess second, for healthcare capacity, can you talk about the bed capacity that we have now, whether area hospitals are already on surge and how they're, I guess, going through that? And if you know how many potential patients or potential COVID-19 patients are currently hospitalized. That's it.
Dr. Jungir.
Thank you so much for the question. First, in regards of location of the assessment centers, we placed the assessment centers where we felt we could serve the residents of Nashville best. Places where may have limited access to healthcare, may have it harder to come to the facilities currently available. So that's how we decided where the assessment centers go instead of where clusters may be. Regarding the question about surge capacity, it is, as I've probably mentioned before, it is something that is, I know, on my mind, I know the mayor's mind, I know on Chief Swan's mind. Every day, we actually spoke about it yesterday with the Unified Command when the mayor and I visited the governor. We communicate daily with our hospital systems. Our hospitals have made some tough decisions, such as canceling elective surgery and other things to increase their capacity. As of today, we're okay for where we are. But again, this is the whole point of saying flattening the curve. We can have thousands and thousands of beds and vents. But if we have an amazingly large amount of people infected at one time, then the system is going to be hit at capacity because a certain percentage of those people are going to need to be hospitalized. As of today, we're at a good place, but we are constantly thinking about it. We're developed surge capacity, and we're in constant communication with local officials, hospitals, and state to try to make sure we don't hit that magic point. So thank you.
There are no more media questions at this time, so we will end the Q&A session. There's no live briefing scheduled for tomorrow. Live COVID-19 press briefings will resume on Monday morning. A video recording of today's broadcast will be made available later this afternoon. Thank you, everyone, for joining us. This concludes today's Metro COVID-19 press briefing.
All right, that was a live press conference with officials sharing the very latest information on the coronavirus outbreak in Nashville. There are now 376 cases. That's an increase of 64 in just the past 24 hours. Stay with News 4 for continuing coverage. When we're not on air, you'll always find our coverage online on the News 4 app. We now return to your regularly scheduled programming.